There has not been a dull moment in my life since the first conference call on COVID on January 17th of this year. Every single day is extremely full. You're both on meetings as well as answering emails. The term multitasking has taken on new meaning during COVID. I grew up on the east side of Bloomington on 10th Avenue Circle, so it was kind of the southeast-eastest part of Bloomington. My father just moved from Bloomington after living there for 54 years. So our family house has been there my entire life. I attended Indian Mounds Elementary School and then had a chance to go to a special program at River Ridge Elementary, and I went to Oak Grove Junior High. We had junior highs back then. I did have a very short stint playing softball for the Bloomington Athletic Association. I'm not particularly athletic, so it was a short stint, but I did do that. My brother was very engaged with BAA. When I was in junior high, I had gotten a Schwinn varsity bike, and I really liked riding my bike, and I got a map of Bloomington, and I was trying to ride on every single street in Bloomington, so I would track on my map where I had ridden my bike. So got a good on-the-ground appreciation for my city. I remember as a child taking the bus to go to the public health building to get my polio sugar cube. I also remember when the public health nurses came to our school to give us our vaccine. So I had some early memories of public health in Bloomington. I went to St. Olaf College, and they have a really strong international travel program. And at the time that I was there, they had an opportunity for nursing students to travel to India for a semester. And so it was called a service study program. So we were both learning while we were there, and then we had the opportunity to work in some of the hospital wards and have some experiences out in the field in some of the rural areas. And that experience really changed my life. I mean, seeing a developing country, seeing the needs, it really changed my perspective. For someone who had grown up in Bloomington, and Bloomington's a wonderful community, but I had so many opportunities, and I saw a part of the world that didn't have those same opportunities. What got me into public health was actually working in the Bloomington Heart Health Program. It was a study that was being conducted by the University of Minnesota, and they were it was at a community level, and they were using two communities. One was Bloomington, and then our sort of control city was Roseville. And the idea was that we were going to do education and kind of intervene in Bloomington to help residents be healthier, and then we're going to look at the community level to see if there was an impact on heart health as it related to emergency room visits, cardiac arrest, all of those kinds of things. I was volunteering with that program because there weren't nursing jobs at the time, and I really loved it. And so I thought, oh, this is being conducted by the university, and maybe I should be a health educator. And so I reached out, and I actually ended up having an interview with the head of the epidemiology program, who really encouraged me to go into epidemiology. So I was a graduate student at the University of Minnesota. I had the opportunity to work under Mike Osterholm, who is obviously a renowned epidemiologist, and he's actually the one that hired me to the health department, and he's been quite influential in my career. What struck me about Mike, and one of the attributes that I really wanted to make sure that I tried to emulate, was he was really good with the public and kind of explaining what the issues were, and being pretty clear about what to expect in an infectious disease situation. And so that was something that I really wanted to work on, was to be able to be a clear communicator about the messages that were important for public health. This response has been incredibly demanding, and so I had literally months where I worked 7 days a week, 12 hours a day. So I didn't have a lot of time to do anything but work. So that's definitely a way to avoid social interactions, is when you don't have time to see people. This year has been like no other. And even for those of us in public health who have been planning for pandemics and even responded to the pandemic in 2009-10, this has been like nothing we've ever experienced. Every case is like throwing a rock into a lake, and then there's the ripples that come out from that that toss. And so you may be one case, but it's that ripple effect. It's the people that you might expose. It's the roles that you play. Maybe, you work someplace, and so then now you have the potential to expose people in your workplace. There's nothing that's quite the same as having things the way they used to be. So I understand that people are really frustrated, because I miss it too. Really gotta stay focused. This won't be eternal. I would say that my career in public health has been so interesting, and I've had so many diverse opportunities. I think the best thing you can do is have as many experiences as possible. Obviously, it's very mom sounding, but school's really important, so you want to make sure that you're focusing on that. But I would say don't even limit yourself to what you can imagine right now. I guess it never even occurred to me to go somewhere else, because my family's here. I have really strong ties to Minnesota, and just wanted to do my thing in my state with my people, I guess. Minnesota is my place, and so I'm really glad that I've been able to work here, and I'd never even dreamed of going someplace else. I love Minnesota. I had no idea that the volunteer work that I was doing for that program in Bloomington would change my life, but it did.